Hello, my name is Crystal Wright, and I will be presenting on cinnamon extract lowers glucose, insulin, and cholesterol in people with elevated serum glucose levels. This study was done in China by Richard A. Anderson, Ziai Wei, Zhuan. And out of respect for the Chinese researchers and people and participants in this project, I don't want to butcher all the names, so I won't continue to pronounce them. But yeah, so cinnamon we know has had a long history, not only just as a flavor additive, but used in traditional Chinese medicine, used as a preservative, and also other pharmacological agents. There was a 2004 study that spanned over 40 days where participants who had type 2 diabetes were administered 1, 3, and 6 grams of cinnamon, respectively. And they showed significant improvements in not only just their glucose levels, but their triglyceride levels, their LDL, so lousy cholesterol, overall cholesterol levels. And there was also a placebo group for the study that showed no significant improvements. There have been 4 recent studies on cinnamon and its effects on these levels that I just mentioned below. And out of the 4 studies, 3 of them have shown positive effects of using cinnamon extract or a supplement. Although it was noted that further research does need to be done. Hope this doesn't wash me out. I figure we need a little bit more light. There we go. That's a little bit better. Sorry. So in China, there's an estimated 90 million people with diabetes, and about 150 million people are diagnosed with prediabetes. And this can be contributed to the rapid change in not only food consumption and intake, but also lifestyle, but also a lot of adapting more to a Western style of diet and living. So those are some contributing factors. With the higher risk of getting diabetes, we also know that it causes an explosion in some healthcare costs. So this research goes to ask the question if cinnamon extract should be considered as a preventative supplement to be able to alleviate the elevated blood glucose level, thereby not only reducing the risk for morbidity and mortality, but also to help reduce some of the healthcare costs. So participants for the study were selected by 2 major indicators. One, their fasting glucose, and I used the US and also the metric calculations for this. So fasting glucose had to be greater than 110, but no greater than 360. So greater than 110, but no greater than 360. Another factor that they were used to include a participant was their 2-hour glucose reading had to be greater than 140, but no greater than 450. At the bottom, I included some exclusion factors. So factors that excluded participants from the study included any type of serious complications like cardiovascular or cardiac dysfunctions, or if they're currently on insulin therapy. A total of 137 participants completed this study, both between male and female. I don't know if I mentioned that before. 73 were in the placebo group, and then 64 of them were in the treatment group. No participants mentioned any type of complications during the study. The participants were assigned 2 random groups, and this was a double-blind, placebo-controlled study. So the participants nor the researchers knew who was getting what. So the treatment group was given a commercially available spray dried water extract of cinnamon, kind of comedically called insulin. And it also contained 4% of the component procyanidine, which is a component that is related to bringing down those insulin levels, and also a component to help combat inflammation. So yeah, which there you go. And each of them were given 250 milligrams of the cinnamon extract twice a day, so 500 milligrams daily. Our placebo group was administered 250 grams of dark brown wheat flour that was colored and baked to look like cinnamon. In this study, 36 subjects did not complete the study because they either had a change in medication during the study or they missed a blood draw. So that disqualified them from completing the study. And at the conclusion of the study, the participants had to bring back their capsule bottles to confirm the study compliance. So one acronym that you will see a couple times in the study is the HOMA-IR. And what that is in layman's terms is just the homeostatic model assessment, which is just a method that they use to assess the B cell function, so beta cell function. So beta cells are what produces insulin, and it compared to the insulin resistance glucose. There we go. So clinical-wise, some calculations or data that was collected from each of the participants was their height and weight, which was measured at the onset of the study and at the conclusion of the study. Their BMIs, their blood pressures were taken after 15 minutes of rest, and that was taken twice just to kind of ensure some accuracy. And then they had the postprandial glucose that was obtained by measuring 2 hours after each participant had consumed 100 grams of steamed white bread. Some some things that were analyzed during the study were the whole purpose of the study. So biochemical, quantitative glucose measurements, and the statistics were based and compared to the baseline. So all of this data that was collected at the beginning of the study, for each group, it was compared to the baseline, so the initial data. So this chart here shows the initial data collected from all the participants in the study. I failed to mention that the average age of participants in the study was 61.3 with a standard error of about 0.8. So yeah, this is information for all of the participants. Then we have it broken down for participants with their BMI that was over 24. And then we have it further broken down to participants who had their BMI between 24 and 28. And then we have participants who had a BMI greater than 28. So at the conclusion of the study, like I said, it was compared against the baseline. So all the participants in the placebo group were compared, their numbers were compared to the baseline of the placebo. And then all the ones in the cinnamon group were compared to the cinnamon group. So like I said, the incidences of type 2 diabetes is exploding, not only in China, but in the States, and we know this. And this risk has caused increase in healthcare costs amongst populations. We also know that there are drugs on the market that help manage diabetes currently, but one of the purposes of this study was to find a more cost-effective way for managing that. So that's why cinnamon was used in this study. So like I mentioned, cinnamon is a lower cost or a low cost alternative to metformin and other diabetes medications on the market. It's more readily available and it can be easily implemented into a regime or a routine for people with type 2 diabetes. It is noted during the study that the participants that are hypoglycemic, obviously, but 70% of them were overweight or obese based on Chinese BMI standards. Yeah, it was interesting. Also noted in the study that many men and women were classified to have metabolic syndrome based on not only just their glucose levels, but their lipid levels and their blood pressure values. Yeah. More investigation is needed for this. There have only been about a handful, like 5 true studies, looking at cinnamon and its effects on these blood panel results. Cinnamon extract is very rich in like the anthocyanins that are particularly effective in quelling the inflammatory compounds, so the things that do cause the higher blood pressure. One thing that was interesting is that in this study, there was an unexpected increase in the final results of the triglycerol levels, which was not expected in the original on the onset of the study. So that was something that they want to take particular attention to. Wow. So yeah, this documents the effects of 500 milligrams of cinnamon extract per day on Chinese adults with elevated blood glucose. I'd like to give some acknowledgments to the people involved in the study. And also I included a few references in addition to the study that I researched. Thank you and have a great evening.